From the Jackson County Health Department, we have the Community Health Coordinator and Maternal Infant Health Program Coordinator and Early On Coordinator, Ann Sloan, and Early On Coordinator Melissa Baumgartner. Welcome to the show.
Thanks for having us.
Yes, thank you.
Happy New Year. Now, in all those words I said you were, did I get your title at least partly right?
You got it 100% correct, yes.
Great. Well, great to have you with us. Happy New Year.
Happy
Yes.
New Year.
Did you guys have a great holiday?
Fantastic.
Yes.
Good. Now, I keep thinking this week we're really not fully back at it. I count this week as part of the holidays. Is it like that at the health department?
Yes, we have a little bit of a skeleton crew due to vacations and different things like that. So
Yeah, and I think with the kids not back in school yet, it feels we're still holiday-ish.
Right,
Yes,
still have
yes.
another week.
Yeah, we still have another week, so relax a little bit more. So this month, the health department wants to share with our viewers some of the services that are available for women and children in the maternal health. Early On, first of all, what is the Early On program?
Our Early On program, we service children who are from infancy until their third birthday. Melissa does direct in-home service coordination with families for children who are eligible. Anybody can have an evaluation. They're completely free. And you can go to 1-800-EARLYON.org to make a referral online, or you can call me at 768-2114 and I'll take the referral right over the phone. And then we do an assessment, and after the assessment is completed and it's determined that a child is eligible for Early On, Melissa will get assigned a case. We have two coordinators, Melissa and then Misty. Melissa was gracious enough to come with me today and share about what she does. But yeah, I mean, again, evaluations are free. There is no charge for an evaluation at all. And then we can work with children up until they're 3 years old.
And once you're qualified through that phone process, what are the, I guess, benefits or services of the program?
So once I get the case, after the evaluation is done and it is determined that a child is eligible for services, which I just wanted to point out that it is not finance-based. It is for all children in the community with a health, physical, or developmental delay.
And our goal here, and I think the whole county, everybody involved in health and child care, has been to better our statistics when it comes to maternal health, infant health, infant mortality. We've had some bad years where things haven't looked that good, and I know there's a big focus on keeping babies safe and keeping them healthy once they're born. And that's a lot. That puts a lot of pressure on you guys. Yeah.
It does. And so also when you were asking about like the services, what I do, I go and do home visits, which means I go into the home, I work with the family and the child at the same time. So I'm not going in and doing any service with just the child. I like to always say, I'm here to help you help your child.
Are you a clinician or are you an administrator?
Clinician.
Okay. And same with you?
I coordinate.
Okay.
The Early On Part C is actually, what we do at the health department. We collaborate with the ISD to provide Early On services. So whenever there is an identified need, such as occupational therapy or speech therapy or physical therapy, I'm like, what's the other T in there? We'll refer to the ISD if they need to do an evaluation if we're starting to notice some delays, but that is where Misty and Melissa come in.
So a parent, they might notice something doesn't seem right with their baby, and so essentially you're the first people they should call.
Yes.
right?
Yeah, we'll get referrals from pediatricians too. So during well-child checks, if the pediatrician notices something maybe is a little off or there's a concern in whatever domain that may be, we see, you know, motor skills and communication, some social emotional regulation. We can do the assessment and then determine whether or not, you know, they qualify.
All right, let's give an example. We've got maybe a parent calls us, my baby, he's not talking. He should be talking. My other kids talk. This baby is not talking yet. I think he should be talking. Is that a typical call?
Yes, that's very common. Yep, a lot of speech concerns.
And we've noticed that over COVID, either children who are born right before COVID or during COVID are coming to us mainly with speech delays.
Really?
And I feel like a lot of the delay is because we're wearing masks or we're not going out, the children aren't socializing, they aren't, if we are wearing masks, I noticed myself, we don't talk as much when we have a mask on. Nobody can hear us, we don't want to continue to repeat ourselves, so we just don't say anything. And parents are either not talking to their children enough, and no fault of their own. It just kind of happened during COVID.
Yeah, and I've noticed with, like I have a 1-year-old grandson, and when I'm talking to him, he's putting his hands, or he's trying to put his hands on my mouth, or he's looking at my mouth. A lot of the learning at that age for speech is visual.
Right.
Absolutely.
And when we do get calls about speech concerns, kind of one of our first go-tos is to make sure that they can hear if there's not a hearing impairment. Just because an infant had a hearing screen, you know, after delivery doesn't mean that something couldn't have developed since birth. So that's something we'll always want to look at initially as well.
What age do you typically hear from a parent? What child age?
I'd say for speech related concerns, probably 20 to 24 months.
So they should be well underway with some sort of communication by then, and then obviously that's the raise for concern.
Right.
Yeah, especially if a child isn't, I call it babbling or making any noises, like mama, gaga, baba, you know, those types of different vocalizations, and not necessarily saying complete words at that age, but if they're not making a lot of vocalizations, then it definitely could be a concern, and I mean, rather be safe than sorry.
And when you make a home visit, do you find some things that are in the home that maybe are contributing to the problem? Maybe there's some evidence of substance abuse or some sort of domestic situation that isn't safe or healthy for the baby?
It could be the case. Most of the time, it's kind of predetermined in that we would get a case from the CPS. I haven't run into a case where I would go into the home and then find something, but I do go into the home and find out that they never thought about doing this type of activity with their child. And so that's where I come in and kind of help them and coach them onto how to play with their child, how to involve their child in a specific activity that's going to help their development.
So the assessment, the first contact determines there's something that the child needs. Maybe it is speech therapy, maybe it's hearing aids, maybe it's something. What about the cost? And does the family, are there ways to help pay for whatever that child needs? Or is the family on their own with whatever their insurance happens to be?
I think it depends. Like our service is going to be completely free. If there are assistive devices that a child does need, then it depends on what exactly it is. We may have funding for that to help cover those costs, such as we have a contract with Miller Shoes, and sometimes our children need like a specific type of shoe to fit a brace in, just to help them walk. And we do have some funding that can help with those types of devices.
What about before a child is born? Is there any Do you have families contact you before? Are there services for maternal health before a baby is born that you provide?
That's where our maternal infant health program comes into play. That program, that is a Medicaid covered program for pregnant persons or infants under 12 months old. And that's also a home visiting program. Over the last 2.5 years, we've been able to do telehealth, and we still can do telehealth. So it's a bit of a hybrid right now between doing in-home visits and then doing, video or phone calls.
And how does a family know or a mom know that this is something that's for them?
How do they know?
Yeah,
or?
do they, maybe they don't have a doctor. Maybe they haven't lined up a pediatrician. Maybe they haven't had a visit with an OBGYN. Do you try to get them connected to a provider at that point?
Oh, absolutely. We provide that type of assistance. A lot of our beneficiaries hear about our program through their health insurance. So we contract with 5 different Medicaid health plans that are accepted here in Jackson County. And we also get a lot of referrals from our WIC office as well. And WIC is housed right within the health department with us.
A lot of connections between the various parts of the county health department that are available for these families.
Yes.
Absolutely.
Last year the big problem was infant formula. Is it solved?
Not completely.
No.
We actually just talked about that this morning.
Really?
There are still some shortages, depending on what the child's physiology is. So let's say that there's a child who has a lot of acid reflux or a lot of different GI problems. There may not be the amount of formula for them. So sometimes we have parents that are switching formulas, which isn't necessarily a great idea, but it's the only solution they have right now.
Now there are various insurances that are available, and then there are some that are provided by the federal government, the state. It can be challenging for a family to navigate all of that insurance detail. Do you have people that help with that?
Yeah, in our MIHP program, we have nurses and social workers who work with the family and can help navigate the systems that can be very complicated. And in addition to making referrals to community resources, our MIHP program, collaborate all the time with early on because we do regular developmental screens. It's one of the components of the program that we're required to do. And if we identify a delay on the screener that we use in that program, then we make a referral to early on, or at least talk to the family, because everything's voluntary. Nobody is required to do any of this. So we just let families know what options are available to them.
Yeah, it's families that are concerned about the development of their child or the health of their infant. They want to be proactive and they reach out to you guys.
Yes.
And how do they do that? Do you have a website, phone number?
So we have the Early On website. It's 1-800-EARLYON.org, right?
Correct.
Okay.
Yes.
It's a website and a phone number,
Yes.
all in one.
Yes. Well, and my direct line is 517-768-2114. And anybody can give me a call if they're interested in learning more about Early On or our maternal infant health program. I can take the referrals right over the phone. We actually have, I should have brought it with me. We just developed a QR code for referrals to our MIHP program, and it's been incredibly useful because WIC, for example, can send us real-time referrals. Like if they have a patient in clinic and they are determined to be eligible for MIHP, because it's all you need is Medicaid, that's it. And we don't charge for any services, but they can do the referral right on the QR code, and I get it in an email instantly. So there's no delay.
Cool. Interesting to hear that COVID is having some impact on children's development. Speech, one area you've noticed anywhere else?
Some gross motor, so large muscle delay. Either kids are being held a lot, which is fantastic. However, they do need to be put down, you know, to get some development and let their muscles build.
Just like us.
Yes.
Yep. Great to see you both. Thanks for coming in.
Yeah, thanks for having us.
Happy New Year.
Yeah,
Happy New Year.
Yeah, and thanks for the great services you and the health department provide.
Thank you.
Ann Sloan and Melissa Baumgartner with the Jackson County Health Department and the Maternal Infant Health Program and the Early On Program. More to come on today's show. Up next, we've got Property of the